so I'm just like, just feeling that in my body as we arrive together. Speaking of as we arrive together, folks are going to continue to pour in. We heard there's like 100 folks registered for this. But I don't know about you, I've been on 6 hours of Zoom. I just ate a quick lunch. And so I just want to invite for myself and for all of us to like do whatever it is that your body needs to do. Roll your neck, take a sip of water, take some breath, and arrive here from whatever it is you were just doing prior to this, whatever conversation, whatever constellation you were in, and give yourself the gift of arriving here for this conversation. I'm loving seeing geographically who's in the room. Boston, Massachusetts showing up, Chicago, Detroit. My team is here. All right, Massachusetts, y'all really turned out. I'm loving it. Jersey, welcome, welcome, welcome. It's Birth Center Week, y'all. How many, by like show of, I can't see your hands, but in the chat, folks have been coming to other Birth Center Week panels and engaging on socials. Did everyone see the influencers who have been hyping us up? Yeah, super exciting. It's the third year of Birth Center Week, and each year gets better and better. And can't wait to see where we go today and in the future. I just froze. I'm going to start with just a brief intro of myself, and really we're here to hear from our amazing panelists. I want to just say that I am here in Boston, in Massachusetts, on the unceded Massachusetts territory. I'm the executive director of Neighborhood Birth Center. I helped to co-found Birth Center Equity. I'm not a midwife. I'm not clinically trained. I'm a public health person by training, came through government. But I am a lover and follower of midwives, and I am a two-time home birther. This conversation means so much to me because I wouldn't have expected a couple years ago to be working so much on policy change. But here in Massachusetts, we had a big win last summer, and I love the title of this panel called What Works for Us. We want to learn about what has worked from our panelists, but also honor the lessons and bumps along the way. We don't get through big, radical coalition building led policy change without kind of taking it on the chin sometimes and spending more time at the State House than we do with our own families. And so we want to also get real here and really invite vulnerability from the panelists, because it's about what works for us, and that includes being, honest about what's challenging and figuring out in that hard context how we keep it moving, keep pushing. Again, like a couple of years ago, as I was working on opening this birth center in Boston, I would not have imagined myself, leading a conversation about policy, nor, hiring my first full-time hire as a full-time policy director. But I did know that we had onerous regulations and terrible reimbursement. And my conviction at that time was to open the birth center in spite of it all, and to build a business model that reflected that context, and to just turn to philanthropy to close the gap. But there's a really active birth advocacy group here in Massachusetts. Shout out to Bay State Birth Coalition, who've been organizing for years on various policies to improve access to midwifery, among other things. We also took a page from Birth Detroit's playbook in hiring that full-time policy director, who's also a midwife. If you can find the Nicoles and the Catherines who are like policy wonk midwives, that's a win. And so together with that coalition, we went to lawmakers and we said, we've bought this land and we're struggling to open this birth center under these burdensome guidelines. And we can't be fully staffed without growing the workforce. We can't open the doors if the clinicians aren't paid fairly. And so we found ourselves like deeply immersed in policy work. And last year passed the most robust maternal health package of bills that the state has ever seen, that includes licensing CPMs and a whole bunch of things in there. And we are really benefiting from the passage of that, and including just in our new design under these new rewritten regulations. So just bringing like my own interest and kind of like having, figuring out, building the plane as we fly it, as those of us who are, public health folks, midwives finding ourselves entrenched in policy work, and also grateful for the policy wonks in our midst. So with that, I want to say one other thing. Actually, at the end, we're going to give a shout out to 50 by 50. But first, I'm going to introduce our panelists. Each of our panelists are going to have a few minutes to speak. I will give you a little hand when you're about 2 minutes from the end. And, we'll be as gracious as we can with the timing. We're not going to cut you off. I'm really excited for the conversation. And then in the end, we're going to open it up for discussion. And we invite your questions throughout. We'll be monitoring the chat and documenting those. And then certainly at the end, you can come off mute and raise your hand, and we'll get into a rich discussion. So with that, I am joined by my friends, Valerie, a midwife, birth equity champion, founder of Chicago Southside Birth Center. Shout out Southside Birth Center. My goodness, y'all are doing the most out there. She is the leader in residence at Chicago Beyond. Is working on building her own birth center, a nonprofit Black midwife-led, culturally concordant, community-focused birth center in the South Side. And Janine's work was influential in pushing through Illinois House Bill 738, expanding access to birth centers across the state of Illinois. Janine is a partner, mama of 3, all born at home and at a birth center. And Shanae is a dedicated leader, Black abolitionist, community organizer, committed to equity, justice, and building systems for us, by us. Shanae is the founder of Black Mothers in Power, a statewide nonprofit dedicated to Black maternal health, which includes initiatives like Bail Fund, participatory budgeting, food insecurity response, and birth workforce training. Currently campaigning to open a maternal care center focused on supporting Black families across the state of Delaware, located in Wilmington. And actually also serving as the 2nd district council person for Wilmington. So in the belly of the beast. And my friend Myla Flores is on a mission to improve maternal health care in New York City. Over the last 2 decades, she's become heartily and broadly experienced as a full spectrum doula, midwifery birth assistant, childbirth educator, lactation counselor, and mentor to many. And if I'm right, Myla, I think you are coming directly from an award ceremony this morning where you were recognized as a CNN champion for change, yes? All right, love it. We're going to celebrate that today. We want to hear a little bit more about that. A CNN champion for change for her work as a leader and visionary in the birth field. The Womb Bus was when I first met Myla, like this vision of a mobile wellness hub bringing education, resources, and outreach to blossoming families throughout the Bronx and New York City. And Myla co-founded Miriam Reproductive Health and Wellness, a clinic at Milestone in their 2nd phase of development to become the birthing place, the Bronx's long-awaited birth center. Myla has also been really steeped in policy work, president of the New York State Birth Center Association, and founding original member of Mobilize Maternal Health Coalition. And last but not least, Crystal Charlie. Crystal has served as a fellow with the Blacks of the Future Public Policy Institute, as director of Back in Our Hands Birth and Wellness for the Greater Mount Zion Community Development Corporation, and as senior organizer with Salvation and Social Justice, leading campaigns that advance Black maternal health and reproductive justice across New Jersey. She is the lead and founder of Melanin and Maternal Wellness, a village-centered organization working to eradicate inequities in Black maternal health. She co-authored the award-winning curriculum, My Black Health is Beautiful, which promotes reproductive health equity and education, is part of the National Perinatal Task Force, and serves on a number of boards: Fair Share Housing Center, Planned Parenthood, and Sister Song. And while Crystal worked at the New Jersey Juvenile Justice Commission, she supported the development of key reforms, including a restorative justice bill. So we are representing geographies and different trainings and different experiences here, and really just excited to turn over to you all. I'm going to go to Janine first and invite you to take the next, 7 minutes or so. I mentioned in your bio that you were part of a coalition that passed really historic birth equity legislation. So if you could start telling us a little bit about that legislation, and welcome, just kicking off is like, what advice do you have? There are folks from around the country on this call who are thinking about moving state policy to increase birth equity. So what advice do you have for us?
Thank you, Nashir. Thanks, everyone, for the invitation to be here today. This is such a, I feel like even, this is always an important topic, but I feel like even in this climate, it's really, really important um, to think about ways we can remove birth centers forward. I would love to talk about the birth equity legislation that passed last year, but I have to go back a little bit because I really think it's the work that we did in the initial steps of working on Chicago Southside Birth Center that led to the relationship and the trust building that we developed with the government. So back when we began working on Chicago Southside Birth Center in 2020, we knew that we were going to have to change the legislation to expand birth centers across our state. I'm in Illinois, I'm in Chicago, the Chicago Southside Birth Center. And so birth centers in our state were part of a pilot project um, for alternative healthcare facilities, so like dialysis centers, children homes, and things like that. And in that pilot, it was going to establish 10 birth centers across the state, but they were very restrictive on where those birth centers could be. There were larger amounts of birth centers that could be in rural areas, like in Southern Illinois, and very limited who can own the entities. So that means like, are these for-profits? Are these independents? Are they hospital-owned birth centers? Are they FQHCs? So literally, when we decided that we were going to start a birth center, we had to change the law to even be able to do that. And so, FB 738 was passed in 2021, right after we incorporated as a 501(c)(3), and that change in the legislation allowed for 7 more birth centers to be in the state, but they had to be in areas where the Black maternal mortality and morbidity were worse than the state and the county. So that was really the start of our work. We befriended a bunch of advocates that helped us move that policy along. I know my previous supervisor, her partner, did a lot of lobbying, so he was able to act on our behalf, introducing me to legislators. I was in front of staffers every day, alongside working a full-time job, being on call 3 days a week, those kind of things. So I remember like testifying at our hearing in the Senate, how in the Senate in between like a person having a baby and then I was going to run to the next room, but I had to testify real quick. So this is like the work. This is how we do the work. Like the midwives, the birth workers, folks who are doing policy, like it happens in between the other things that are happening in our lives. And so when that passed in 2021, at the same time, the Birth Center Licensing Act passed in Illinois. So now birth centers have their own licensing, not part of this alternative healthcare model. So we are the ones that determine our policies. We're the ones that determine our criteria. Midwives can act as the medical directors of their birth centers. In Illinois, midwives have full practice authority, so we don't have to have physician collaboration. So this like between 2021 and 2022 was a huge year for legislation for midwifery in the state. We saw immediately after those 2 birth center bills passing, certified professional midwives got licensure, recognition in the state. And so we were like, and then now we're working on like reimbursement, like you said, Nashir, like reimbursement, making sure birth centers are getting parity in reimbursement, making sure midwives are being paid equitable and sustainably. So I believe all of that movement happened in a very privileged area. I'm in Illinois. I have a governor and a lieutenant governor that's committed to birth equity, that's committed to health, that's committed to like we're a sanctuary state, we're a sanctuary city. Like we have a lot of different political factors that are happening in other places of the country. So I really think it was a good opportunity to begin to talk about birth centers as an infrastructure, began to make relationships between community, philanthropy, and government. And so it was a great opportunity. And a lot of that press around the legislation helped us make those relationships. So moving forward to the birth equity legislation that passed last year in 2024, our lieutenant governor, who's a Black woman, who is committed to maternal health, specifically Black maternal health. She's just amazing and a true advocate. She reached out for a meeting. She just wanted to know how she could use her area of influence to speak on behalf of midwives, doulas, lactation consultants in the state. And so she invited me to a meeting. We had an amazing meeting. We have a lot of things in common. She grows food, I grow food. Like we were just, vibing. And it was from that she wanted to open up that conversation to some of the other organizations and individuals in Chicago, or even in Illinois, working to advance Black maternal health. And so I helped facilitate a roundtable. Okay, thank you, with the Lieutenant Governor, and that actually happened 3 times. It happened twice with her. We invited 18 other of our partners, like our deep family relationship, birth workers working in community, to this table with the lieutenant governor twice, and then once with the governor. And all of those conversations is what influenced that 2024 birth center equity legislation. I really feel like it was in those conversations that they heard us. They brought their team to the table. So like the head of Department of Human Health Services, the head of housing, the head of, safety, the head of education, so that we can have these shared conversations and thought partnership around what it would take for legislation to move birth equity forward in the state. And that's really what happened. And from those conversations, the governor signed into law $23 million towards birth equity in our state. That includes insurance company having to cover lactation consultants, midwives, doulas, for prenatal postpartum newborn care. That included a pilot diaper program, and that also included $1 million towards community birth infrastructure, which is what we received to grow our birth center, and we use that money for our construction.
Janine, um, I went to a place of thinking about the passage of our legislation last year and both the signing of the bill, like standing there behind the governor. And I followed your work on social media. I know your governor, Pritzker, is really, really supportive. I'm curious, just bring us in. I'm thinking of a photo of myself and others when we heard that the bill passed out of the Senate. Bring us just into that moment for a minute. Kind of what was the celebration for you and your team like in that moment, either at the signing or at the passage?
I'm not gonna lie, Nisha. I don't know if we've celebrated. I'm not gonna lie, because like when you're doing this, and I'm sure everyone on the panel, including you, when you're doing this, you're like, yeah, that was great, but we're still raising $7.5 million to open this birth center. We still have to hire people. Like
I know
there's
that's right.
we're still not getting reimbursed 100%. Um, and Tiffany from our board, she just said we're absolutely going to have a celebration, but when you're in it, you're moving. And there has been times where I'm like, damn, we did that. You know what I'm saying? We did that. But then there's something else to be done. Like I feel like, it's all abundance, right? We're gonna move this bill, we're gonna move the next one. And then
Yeah,
everyone, when we're free, everyone is free.
I feel that. We should, with the panelists, you can see we're going to celebrate you right now because that is huge. Everyone can emoji and do our Zoom celebration and just like send you all, like, I hope that you carve out some time to celebrate. I'm thinking about just like we were waiting for it to come out of the Senate. It had already passed the House and we were kind of gathered. And one of the senators came out and said it just came out of conference committee. And the photos of us, like, hugging and kind of like midwives just, erupting. And then you're right. It's like right back into, okay, now implementation, right? So there's all of the pomp and circumstance of the signing, and then you're right back into it. But I do hope y'all feel our love and continue and really do carve out some time because that is historic and monumental. And I think part of the practice is we've got to like pause for those things and really take it in.
It
Thank you so
is.
much. Yeah, go
Yeah,
ahead.
can I just say one thing? It is historic. We do feel the love, and it is great. Like we reflect on it, and we're like, damn, we did that. But I think what really stands out to me, like the lesson that I've learned from this, is like we are in a very particular time where, um, you know, all of that can change in an election, right? All of it can change. If our governor is no longer governor.
That's right.
Like I really think about that every day. It's like we are setting an example nationally for other states to like follow through with supporting their birth workers, or supporting their midwives, supporting their birth centers. And um I don't we don't take that lightly. We know that our friends in other states are not able to practice, are not getting paid, are, getting more and more restrictive in their access. But we have been lucky in this space to push birth equity as well as abortion care. So I think it's really that is not lost to us that we are doing this to also bring other people along in other areas with us.
That's a perfect segue to where we're going. And I think, in Massachusetts, we looked to other states to, look at their legislation and their regulations. And now we have, historic legislation that we can share with other states as, they go through it. And so I think you're right. We're making the path by walking it, and doing it. And I appreciate that you harken back to like no one is free until we're all free. Um, Word. So with that, Shanae, we're also hearing that you're involved in some exciting birth justice legislation in Delaware. Can you tell us a little bit about it, how it evolved, and as you gear up for organizing for moving this legislation forward, kind of a little bit about your strategies and what's working for you, and the honest part about what's hard. It's welcome to. Thank you.
Yeah.
Welcome.
Um, so where do I even start? So I was listen as you the last Janine, right? I think I said Janine was answering questions. I was thinking of like exactly like how did we get to this process? Like what did it even look like for the pieces of legislation that we passed? And I want to say, even as I'm a legislator too, so I serve on Wilmington City Council. So, and Delaware is small. Like our landscape is small. You can drive through us in 2 hours. So I'm close with the governor, all the state reps and senators, just being involved in community work and drafting legislations. But I want to say what was so key to the work that we were doing in the legislation that we passed in Delaware was the relationships, right? So when you're thinking of like how are you going to build policy in your state, start building those relationships. When I got into politics, so it's been about 5, 6 years for me. I couldn't even tell you what district I lived in. I didn't know a difference between a council person and a state rep. I paid no attention to politics. And I remember when I was a part of this organization and I wrote my first piece of policy. Like I did, they taught you how to write policy, and it was on Medicaid reimbursement for doula services. And that was my first piece of policy that I wrote. I did the research, I wrote it up, I was able to draft it like a state ordinance. And that was so powerful for me when I was doing that work. But those are the type of relationship things you need to know in your skills as you're building your relationship with your legislators to have these conversations with them. So I think it's really important to build relationships. And then I joined organizations to replace people on the state legislator in the state of Delaware who I know would support the things that I cared about, especially around Black maternal health care. So we went into building relationships with current state reps and learning the landscape, working with organizations to teach us how to run and how to draft policy. And then we started creating issue campaigns. So, one thing with all policy, I think is so key and important is community involvement. There has to be there has to be community level work in it. Right. So for me, we created issue campaigns. So the issue were doulas, right? So then we came up with like maybe 2 or 3 policies that we wanted to focus on. And then we engaged the community so that we had people power to knock doors, people power to do the phone calls, people power to go down to the state legislator for doula day. Right. So those things were all key and important. It's like really being before I'm a politician, I am a community organizer, right? So it's like you have to do that work for your state legislation or any legislation really to build relationships, building your own skills, and then building up that people power because you have to have community for these pieces of legislations to pass. So in the state of Delaware, back in like 2021, I want to say I met with State Representative Melissa Minor Brown. It was very few Black women in the state of Delaware at the time who served in the General Assembly. So I met with her and I was just like, I wrote all these bills in my policy class skills that I taught around maternal health care. Are we able to do this? Like, I knew nothing, right? And in that, she was able to help and draft the piece of, so she became the voice of it, right? On our end, we became her support system. Where do you need us to be? You need us at this meeting. Who do you need us to call? Oh, you need us to call this person. You need us to show up here. We became her voice in a different way to encourage people to support the legislations that we wanted to see. So in 2022, we were able to extend Medicaid coverage through the first year postpartum. We were able to update who served on the Child Death Review Commission. We included protections for pregnant prisoners requiring restraints. We required Medicaid provide a plan for coverage of doula services. So we're like, Medicaid, start coming up with a plan. And we also require bias and competence training for healthcare workers. And then we provided access for doulas and midwives to be able to go into Baylor, which is our women's prison. We only have one in the state of Delaware. And that's what we did in 2022. In 2023, we were able to get the coverage of doula services via Medicaid. We were able to get that covered and
Is
started.
that you or me?
I'm sorry. Oh no, I'm sorry. I thought I heard.
Somebody was off mute. It's all right. Go ahead.
Oh no. And then our next piece of legislation was that hospitals it provides that hospitals could not provide in-person visitations by a doula, providing doula services with a pregnant or postpartum person. So what happened was that, as everyone knows, during COVID, they were saying that doulas couldn't come in, that you can only have one person and it was counted in their in the number of people they can bring in. So if I'm pregnant, you can only bring one person in. You couldn't even bring your doula in. You have to choose between your husband or your doula. So we passed legislation to make sure doulas were not counted in their visitation count, and that they were just a standalone person that can come in to the hospital with families. So we did a lot of work around that. There's so much we did in 2024. I can't even go through all of it, but we did a lot of work around like doula services, really advocating, we're moving into the midwife lane, starting to talk about what does that look like in the state of Delaware. And there's literally, it looks like nothing here, right? The same issues everyone else is having is exactly what we have in Delaware. So we're trying to expand access, make it more workforce training. So we've been talking to like our local community colleges and our universities here about starting a doula not doula, a midwife program for all levels, CPM, CNM, all 4 or 5, right? And like what does that look like, and how do we build capacity of workforce? How do we build capacity for affordability, become a midwife? And how do we build capacity if I want a midwife to be able to afford one? So we are pushing for that for 2025, more of the midwives making accessible in the state of Delaware around midwife regulations. Yeah, so that's kind of some of the work that we're doing here in Delaware. And really relationship building. Please build relationships. And I reached out to all Black legislators first because I was like, y'all got to support this, right? So I was very strategic, like Black woman, but I was very strategic in who I reached out to and making sure I build my own skill set, and then also making sure I'm bringing my community with me. Those were 3 key important things for like legislation getting passed in Delaware.
Shanae, thank you. There's so much from what you said. I saw the chat popping off and just wanted to highlight, you said like before I'm a legislator, a policymaker, I'm an organizer.
Yeah, I'm an organizer.
And I love that. And I think like, especially if folks are on the line kind of going like, I'm an organizer, I'm a doula or a midwife, like I don't know how bills are made, that you are an expert in your field, right? We are experts in our field. And so we don't have to be overwhelmed because you don't know, you don't feel like a policy wonk. My policy director, Catherine, said, you know, when she started this job, she was a 10-year midwife, didn't know how a bill was made, right? Now she does, but kind of it's all about the relationships. There are experts in our policy coalitions and in the legislative aides and the legislators who do know how it works. So the relationship is key. And I don't want anyone to feel overwhelmed by not knowing how a bill is made. You know the people and you know how to organize your people. So that was really beautiful. Thank you so much.
You're welcome.
And I'm thinking too, just back to what I think it was, I took a note, it was Mickey Ferreira, when Janine was speaking, said that, bills have birthdays. And so for both of you, like that, what is the anniversary of those kind of milestones that you can come back? So Janine, it's not too late. You can celebrate your first or second birthday of that bill.
Yes.
Just a reminder to all of us to like both, be tracking those milestones while we keep on pushing. All right, next on to my friend Mila. You have been in it. Those of us who've been following you for years know you've been working in the Bronx and across New York. And in particular, to talk today about the legislation to recognize CPMs in the state, as well as other key efforts to expand access to midwifery in an equitable way. What have you learned from the challenges you faced, and what does your strategy look like as you move forward? And then if you have a minute, tell us a little bit about coming off, or you can start with your award ceremony because you're glowing right now.
Aw, that's just the sunshine. And yes,
No,
thank
no,
you.
you're
Okay,
glowing. You can take
okay.
it.
Thank you. Um, I actually came from a different award ceremony, but that
Okay.
CNN Champions for Change just happened a few days ago on their 1 hour special, and I was Abby Phillips Champion for Change, and I do see that as a huge recognition that could amplify the work we're doing here. Because as you guys know, we're doing the work every day. Someone asked me how it felt. I was like regular, and being that we have a discussion. I'm like feeling like excited about like the fact that all the people here and in the audience are passionate about wherever their city, their state is, their birth centers. And so just a shout out to all of us who are doing the work, and for all the days and weeks and years that we do the work without recognition, that this is like a moment that I just, am appreciative, and I hope we can use it to amplify and accelerate our journey towards our birth center. And in terms of the question regarding CPMs and the issues that we're having, and just to level set for those who don't know, in New York State, certified professional midwives they basically are not recognized as a licensure. And our licensing system is designed for nurse midwives and requires a master's degree. And it's inaccessible for many, especially those outside of NYC, because at least NYC has a couple master's nurse degree programs. But our rural areas, which throughout our state, 2/3 of our counties do not have access to maternal care, and that's pretty major. And this lack of licensure is preventing our community from receiving the maternity care they deserve. So we hear New York, and sometimes we think, oh, a well-resourced place. Well, there are maternity deserts here as well. And I'm based in the Bronx, where we it's so uncomfortable to boast these things because it's just terrible. But among the boroughs have notably worse outcomes, and our whole city and country is suffering from this story. So in terms of the strategy moving forward in CPM licensure here, is engaging the state education department. We have a lot of support broadly by many legislators, but the professional licensure for CPMs to be licensed in New York is through the state education department. And so between the relationships that we're building, we're working to make sure that there's like a regents group, and there's two aspects of the education department, and Black women within these departments that we are also Shanae, oh my gosh, am I saying it right? um yeah, that we're also building those relationships and seeing who can become true champions. And in terms of more broadly, what our state is also managing is that the birth center bill that maybe some of you had been following when we passed our midwife birth center bill, maybe many people celebrated we were amongst those who were not celebrating because we were aware of the language in that bill that actually deters the true opportunity for the policy to be applied, right? And so that integration has been something that we've been waiting for this bill to be implemented. And so despite those challenges, the regulatory barriers that ultimately still exist and require an OBGYN, an MD to open a birth center, we're still fighting to have midwifery-led birth centers. So what we did as a state, our executive team on the New York State Birth Center Association really encouraged the birth centers who are operating their birth houses and the midwives who are already doing the work, despite the state not recognizing their work and being permitted to receive the federally mandated reimbursements for their facility fees that would help them be sustainable. Despite them already doing the work, we really just encouraged that they continue doing that work, okay? And that we reached out to American Association of Birth Centers to really communicate that and advocate for the fact that they could still give us the CABC accreditation until New York State provides a legitimate, accessible pathway towards licensure, that they will continue to, put their head down and keep recognizing as a really detailed regulatory uh, organization that they are, that they will still accredit some of our birth centers. So we've had a few birth centers get CABC accredited this year, which we're excited for in New York State. And then I'll close with talking about the Mobilized Maternal Health Coalition, where we were inspired by Massachusetts, and we thought, hey, who are the people, the organizations that we want to come together to become a founding group of this coalition? And so we came together with like 2 to 4 organizations and quickly became 14. And now we are continuing to build this diverse coalition and amplify maternity and infant issues and advocate for key policy changes. And we've had some pretty good successes with building those relationships, including students, filmmakers, policy experts. And we're just between our virtual press event and then our maternal health day of action at the Capitol, we were able to get some good press. And we think that this year, with a plan moving forward, that we can be much more effective. Yeah. And so I just want to encourage everyone who's on the call, because when I think of how much we've learned from each other, and I've heard many people who spoke already just refer to the other states that we're learning from, in Illinois, in Michigan, in Massachusetts, wherever you are. And right now today, I'm like even typing stuff when you were sharing, Shanae. I was just like, just that really strong connection that we have with one another. And I do feel like that is really what birth center equity is all about when it comes to being able to support and uplift whatever's happening in our prospective states. And so I encourage you to connect with each other as well, because we have some lessons. Yeah, thank you.
We do. I thank you for that. It makes me think about the monthly BCE power hours, and like just, some of those have been on policy, but also just asking, BCE to direct, one of those upcoming, so we can get into some of that sharing. There is that kind of like, I love Vicky in the chat says it's so gross when they intentionally create barriers to legislation that can't be implemented, right? And we had similarly in Massachusetts where we thought something would be covered by Medicaid, and now there's like all these workarounds and it doesn't actually have to be covered. And so, how do we create those spaces both like, casually, you and I can text about it, but also in BCE spaces, and in our conferences and in our gatherings to be talking about that. So we can, be catching those line items and be really mindful of those loopholes. Yeah, so thank you for that, and just thanks for your honesty. I think about you all the time. I know you're out there working and tired and still glowing. Let me check our time. So, BB, what's before I pass it over to Crystal for the Q&A, I wanted to just do a beloved birth 50 by 50. So you folks have seen online that BCE is leading this campaign and asking folks to pledge. And today, Ricky Lake, pledged this campaign to achieve 50 by 50. So that means by the year 2050, 50% of babies come into the world in the hands and the care of midwives. And what a swing that is from 90% that are in hospitals and less than that's with midwives right now. And so loving that campaign, and Julie just dropped it into the chat. So I want folks to go to that website and sign the pledge, and then share that on social. And so before we also hang up, Hoi-An will pop some social stuff into the chat so that if you're not already capturing all of the posts, you can engage with those, because we all know that the algorithm relies on engagement. And I learned recently that it's more than just hearting it, like more than liking. You actually have to like comment. That actually does something for the technology. So I didn't know that. I like to heart things, but engage with it, comment, share it, and there will be more posts as we go through the end of the week. So with that, I want to turn it over to Crystal Charlie, who's going to lead us in the discussion. And we have a little bit extra time, so folks, bring your questions.
Thank you so much, Nashira, and thank you to all of our panelists today. We got a wealth of information in 45 minutes, and we have a good 45 to really dive into it. And I wanted to talk about some of the key things that I heard, the resounding messages that, one, this is multifaceted, right? You have midwives who are in between births at the State House or testifying at the State House, building the relationships with legislators, how doulas show up. And so one of the things I just want to kind of lift up of the things I heard, one was that when we're free, we're all free, right? That's, to me, that is the realization of the beloved 50 birth by 50, right? Like that's when we get there, and understanding the need to, seeing this across the board nationally, like how do we set the landscape so that everybody's on the same page? The different challenges that everybody's dissecting and fighting is really, it was what makes the work hard, but we are all in this together. I also wanted to kind of lift up where Janine talked about, celebrating the win briefly, but then you have to get right back into implementation. So I feel like in this work, what we're learning and what we're hearing about is there's, pause to celebrate, but push beyond the passage, right? And then securing the bag beyond administrations, right? That's something that we definitely have to kind of tune into as we're looking to move this work forward. Here in New Jersey, we've had some legislative wins around maternal health, but we're one of two states that has a gubernatorial election this year, right? And so what does that look like? So when we can get to that place where this starts to become, and while we never really want anything, we don't like to use the word standardized because we know everybody's birth is special, everybody's birth is unique. But when we start looking at what it looks like to make sure that equity is standard across the country, that's where we're going to get to where we're trying to get to. So I just want to open it up for question and discussion and see if anybody has anything that they want to ask any of the panelists. But I would like to start. I'll kick it off if that's okay. I'm going to kick it off with Shanae. So Shanae, as a legislator, right, how do you feel that your peers engaged with the birth justice movement, right? And what insights would you offer those of us who are on the call, who wear our different hats, to best engage with those who are going to make these kind of changes beyond? And I always say there's a difference between introducing a bill and championing it, right? And so we want to talk to the ones who want to champion the bills that we're looking for, which means it goes into the implementation phase as well.
Well, so as a city council person where I am in this state, I really I don't have jurisdiction over most maternal health care stuff. Like we don't hospital. So a lot of the work that I'm doing is in my community organizer hat. But I want to say, as a legislator, when engaging with us, if you're looking for someone to actually champion the bill, find someone who's truly connected to it, right? So that's why relationship building is so key and important. And every time, you don't have to come with an axe. Sometimes you can be like, I'm just trying to get to know you. So I got to know a lot of my legislators without like, hey, can you pass this bill for me? But like honestly getting to know them, and then I know how to connect with them based on that issue, right? So for instance, like the Black maternal health care, of course, we all call her Mimi, State Representative Melissa Maida Brown, a Black woman. She's a nurse. She talked about her experience when she had her children and what happened with her and her story. She was able to connect to what we were saying, right? And I think if you can't find that, because I know everyone's General Assembly may look very different and may not be as diverse, I think because community organizing work and I think policy work is not short term. Like most things you're not going to get overnight. It's going to be long work, right? And that's why I think it's important to think about like, how do you build up other people to replace people who are sitting on General Assembly? How are you building people up to run, or you run so that you can replace it, so you have those voices who would champion what you want, right? So I think that's key and important, like working with those organizations, finding a legislator with that connected experience to what you're talking about. They are not even just going to introduce it, they're going to champion it with love. They're going to be intentional. They will care in a very different way and manner. So that is like the best advice that I can give to you. But relationship building is so key and important. And I'm gonna be so honest, as a legislator, if I have met with you 3-4 times, I'm more likely, right, to listen to you. I'm more likely to push something for you than if you're like, hey, I really need to push this bill and I never met with you before, right? Unfortunately, that's just, I guess how some humans are, legislators are, but it's a lot. It's a lot going on here. My emails is packed. But and we have a lot of things to think about. But in that, I think it's so important to relationship build with your legislators.
Thank you so much. And I want to also look at when you talked about being an organizer first, like this work definitely requires us to always build from the community out. I don't like to use the term ground up. I like community out because that's where your power lies. And I want to kind of just transition from you, Shanae, to Janine, because you definitely know what it looks like to build community out and seeing how to, you demonstrate how to engage the community along this journey with the opening of the center, the coming of the center. And so could you share some insights as to what that looks like and how to engage? Because we have to be our own ecosystem. But I know you know exactly how to get that done.
That's a great That's a great question, Crystal. In the beginning, I think it was a lot of, not even I think, I started with the people I knew, right? Before I was a midwife, I was a doula. So I started like sharing what we were doing with clients or former clients, or I have so many friends that are midwives and birth workers. And so it started with that, with our GoFundMe campaign, with, creating social media, to so much so that I love to tell people that we brought our building, where we're building the birth center, cash. And 35% of the cash came from just crowdsourcing, folks in community giving $1 a month, $5 a month, one-time donation of 500. It just, everyone is a part of the birth center. And when we open, we're actually going to have a donor wall with literally, we have like 1,200 individual donors. This is not like grants, funding, state, city. These are like just folks in the community, folks that want to support us. And so it has been a lot of like showing up, right? We have partners where they have events and we're showing up volunteering. We're showing up, having our community events that are free, and we're giving out diapers and back to school stuff and food. It's really, and I really agree with you, Shanae. Like the folks that we work with have all, are all from community, all from the not all of them, but most people, we are situated in the same part of Chicago. And so we're showing up for each other and building an ecosystem and relationships amongst our organizations where we're like in deep partnership with them. Every year we have a free the Latch and Stroll, we do it for Black Breastfeeding Week, where we invite people and community out for food and resources and things. And every year it's like the same people. These are our families, these are our friends, and we show up for them and their events as well. So building community was from the inception, right? And so when you keep showing up for your chosen family, then I think it makes it easier for people to trust you, right? It makes it easier for people to want to be involved. Um, so I don't know if that answered your question, but yeah, from the inception, it has been community. And then, we invited legislators, we invited other folks to join, get behind us, but it's always community first.
Thank you so much, Janine. As we have heard from the panel, we see that everybody really represents different spaces on the journey to where we're trying to be on our different centers and things like that. And so, Mila, you've been at this for a very long time. We've lifted that up, and I too got to see you on CNN. I was super excited when I saw you on there. So again, congratulations. But can you talk to us a little bit about some of the lessons you learned over this journey, because that can help someone along the way. Sometimes, it's great to learn from wins, but it's also great to learn from things that we wish you could do again, right? Or how we could do it differently. So if you could kind of like weigh in on that, I think that would really help our listeners today.
Thank you. And that really speaks to, Nashira's introduction of just the realness of what we might be learning as we go. And I would say some of the top level lessons is the relationship building. I think the second, but probably most impactful one has to do with the way that legislation is implemented, and to really think ahead into that about who that impacts and what other strategies need to be in place to account for that. And I guess not getting played by some of these legislators who really just want to have their win, and sometimes at the cost of the actual policy opportunity, and that's disheartening. At the same time, it fuels in different ways the level of wanting to be more connected with one another, and building the coalitions, whether it is an official coalition or whether you are saying, I know we are in coalition because we are really connected to this shared goal. And so I would say sustaining momentum is a challenge, is a struggle, knowing that we shouldn't necessarily be in this work. Like you guys have all described, like finding yourselves, and even Catherine from Massachusetts was like just a midwife, and now a straight up policy expert. And so this piece about sustaining that type of involvement and making sure that we have volunteers and on the grassroots level, and community driven efforts within it, so that people are all on board. We want to recognize the education that's involved, because we can't learn about everybody's. We can't ourselves be involved in every related policy to maternal and infant health. So how can we create these teaching opportunities? So we've been having teach-ins, and this year we're going to have more, and have different organizations have their teach-ins for the subject matter that they are expert in and have been fighting for so long. Many people may not know the details of the birth center journey here or the CPM journey here, but if you you get to learn about it. I would say cross-sector collaboration is key, and being really creative about who else this matters to, and celebrating the wins when we can, because they may be small wins. And I was just earlier this year in July, like, you know, what did we really get? And, you know, I was kind of feeling that feeling of just like, ugh, y'all know. I saw the nod, Nashira and Shanae. It's just like we wanted this and we got like this. Ugh, so annoying. But then we recognize the this is actually like awesome. Like, you know, we have our workaround, our sidestep to the fact that New York State makes things so freaking difficult sometimes. And then we have more of those relationships that we're like, okay, next year, now we know who's going to be like climbing and lifting and like adding and pouring in some ingredients to this feast that I hope is coming.
Myla,
But
that just brought me, oh, sorry, finish
go
your thought.
ahead.
No,
Go
that
ahead.
just brought me back to my own birth where my midwife was like, that's it, you're stretching. Like you don't go back, right? You're like, it's all progress, even though you feel like that was not the progress I wanted with that contraction or that push. And so I just wanted to bring that up because I think the reminder for all of us who are deeply steeped in birth work is that it really is sometimes that stretching that you maybe can't see and can't measure, but really is having the impact.
Yep. And
We
so
we couldn't not bring this to a birth metaphor, am I right?
nope.
All right.
Everything. Yeah. So just growing the coalitions, deepening the relationships, sharing the lessons, being honest about the struggles so that we can support each other, even just holding space for the fact that this shit is hard. And just you know, being able to recognize that everything we do, we must as much as possible do in community. So figuring out like who else needs to be activated in our networks.
Absolutely. Thank you so much for that, Myla. Are there any questions from the audience that we want to jump into right now?
If folks just want to drop those in the chat, if you have questions, we can read them off the chat.
I'll give folks a moment. I might take facilitator privilege because I've got a question burning, but let's see what comes up. Well, I'll jump in. I'm struck, and I correct me if I'm wrong, but Shanae, Janine, Myla, myself are in kind of blue Democratic, and that doesn't really mean so much these days, but I'm kind of struck given what we're talking about and how our communities have, you know, faced oppression and divestment for a long time, and now is hard, and it's even harder in places where you don't have a Pritzker or a Governor Healy, or, you know, and so I'm just like kind of thinking about one, having a moment to kind of feel for our compadres who are in places where the leadership of your legislation, excuse me, where your legislators don't line up with your not even kind of which side of the aisle, but just kind of having I'm having a reflection about this moment in time, that it's always been hard and it's like next level right now. So just wanting to like acknowledge that, and in particular welcome, you know, questions and space for folks who are navigating in a context that is different than even the stories that we lifted up today. And also just wondering, like, it's not, you know, this current moment in rhetoric, there's nothing untouched. And so wanted to just create a little bit of a space to acknowledge and to invite you all to just talk about kind of how you're navigating now, and if your strategies have changed, and how you're having, you know, what we would call like the inside outside strategies and conversations, given the moment. Or we could just breathe through it.
Yeah.
I was gonna say, whoever wants to take it first, take it first.
Yeah, that question was, it was layered.
Yeah, it was
so
part
layered.
reflection. Yeah.
The most, it's pretty much like how are we moving forward? Like what's next, kind of, or like how are we strategizing?
Just how, all right, how given the federal administration and the kind of like what we're seeing happen, as I saw somebody just said, Jersey's swinging, like just kind of like how things are changing around us. Not to say that
Yeah.
it's ever been rich and lush, but like there is a change afoot, or something else is afoot. And so I'm just wondering if you're changing your strategies, how you're staying in beloved relationship and community. Yeah, and also just creating space for folks who are not in states with supportive governors, like, how we
Yeah.
support them.
I- how to support the other states, I think for me, I would have to think about that one more. But I know in regards to like with all of the changes in landscape happen, live in a pretty blue state, Delaware, well, the northern part, pretty blue. And we have a very supportive governor. We are very pro woman, pro all like we don't have a lot of like barriers and blockage when it comes to those things. But I also do know in this landscape, as they are like fighting against what's happening on the federal level, coalition is so important and key right now. If you're not already leaning on your community, like it is time to now. I'm already feeling the impact of like because I'm only like year 5 or 6. I'm pretty young nonprofit, so I relied heavily on grants. And I'm pivoting in regards to, I think I need to diversify my revenue here, right? And what does that look like, right? So I know for me, it's like strengthening my board, right? How do I get my board to learn more about fundraising? Because my board is doulas, midwives, people who like are passionate and have certain skill interests, but a lot of them aren't really like they don't have the skill of fundraising or understand what that really means, right? So for me, it's really pivoting in that way of like, how do I get a stronger board to think about? We have to think about fundraising in a very different way now than what we did the last 5 years because grant money is starting to shrivel up at this point. So I feel like I have adjusted in that. I also been told that because I very clear the name of my organization used to be Mothers in Power. And I added black specifically because at one of a meeting, a white midwife came out and we talked about all the disparities for black women. And then at the end, she was like, but why don't you just do it for everybody? And I was like, you know what? We're Black Mothers in Power now. I'm standing 10 toes down. Black Mothers in Power. I'm talking about black women right now. We are not going to all lives matter this situation. Now I'm going to make y'all uncomfortable. Y'all going to have to say black. So I know for me, standing in that unapologetically, there's going to be consequences. So I am accepting that as I enter this climate and I'm being unapologetically black, that I probably going to miss out on some money, right? And it's hard because I'm like, darn, I could just change my name back to Mothers in Power. I could take out a little bit of the blackness and be like, and get money. But I wouldn't feel right. I wouldn't feel good inside. I wouldn't be able, I know that I cannot move in that way. So I know a lot of other organizations are pivoting and changing their words. I am saying very intentionally, our board decided we are not going to do that. And I know that is a hard decision that we're making right now. It's scary too. And so that's how I think about our pivoting. We thought about our messaging and how we're getting money. So, yeah.
I love that. I'll just say quickly, I have been thinking about this a lot because we are a 501(c)(3) birth center with the intention of serving primarily Medicaid. So we've been thinking about like what happens if there's these severe cuts in Medicaid. We already are not getting reimbursed equitably. So that was already kind of like in the strategy planning for it. But what it has shown us in this particular moment, and I agree with you, Nashir, I do think it's where we are situated politically and in the country, how individuals have shown up to meet the occasion, right? And we saw it a lot right before the election and then immediately after election. Like people want to invest or give money in a way that aligns to their political and moral beliefs. So we were able um to just be real, like you said, Shanae, like just be real, like we are working to eliminate some of the disparities for Black families, Black women, Black trans folks in our community. And people are like, yeah, I want to get behind that. I don't want to get behind the rhetoric. I don't want to get behind, cuts and ICE and, banning trans rights. Like we want to support that. And so we were able to lean in that a little bit and increase our individual donors versus grants. So, and it's making us think, like, how do we continue to build relationships in community, build relationships. And I think part of that, someone said it on the call here today, that relationship building, that trust building, but also like understanding that once we're built, this isn't ours, we're a nonprofit. This isn't my organization. This is literally everyone's organization. So you have as much ownership in this. Julie, she's on here. She's from our board. She developed all of our strategy for our advisory committee. So like folks from community will be advising us on what we should be doing. So it's like really thinking about ways where, and all of us have said that we're, like you said, Sinead, diversifying our revenue, but also creating spaces and where we can rely on each other. Outside of the Birth Center, I'm working on a project and thinking about ways to increase legacy building for Black women. And one of my mentors, Gabrielle Wyatt, she does this in a way like she says all the time, wealth brings freedom, freedom of choices, freedom of, how you move in a situation. And it's really making me think of like, is there a way that as we are in BCE, this is like the premise of BCE, how do we grow wealth together? How do we grow money and distribute it amongst these birth centers together? So it's like, what can we be doing as we are talking to, grantees or legislators? Like, how can we partner to begin to support our families in these states where they're losing federal funding, when they can't be blackety black, where they can't, provide the service they want to because of the legislation and, the government. How can we begin to support them in that way? So it's making me think a lot about how, because we are privileged to be in a space where we can get funding, where our governor is like, hold up, Trump, y'all not doing this here. But, also bring in our sister birth centers along with us.
I
Thank
just
you.
want, I was going to shout out, there's a question in the chat from Lauren. And Lauren says, in the US, there's so much that's decided at the state level. Is there anything we can do at the federal level?
I might be biased. I think local is where it is. I'm not like, I think your city and your state is really where it is. I think on federal, some of the things we have done, like we have Lisa Blunt Rochester. She's our senator. So she is like pro Black maternal health care. We have a relationship with her, right? And it makes it very easy. She's a Black woman and she supports a lot of the work that we do. Even prior to her being the senator on a congressional level. So I think relationship building with them is still important because we did apply to like their congressional spending fund that they had, but then they didn't get the money, so we didn't get the money due to the climate that we're in right now. But I think you can apply for funding to them. You can build relationships based on like what type of federal legislator you have. Do they support Black maternal health or maternal health care work? If not, you can try to set up meetings to meet with them. Most of the time, they'll put someone on their team to meet with you. But I would pressure that conversation too, because there is funding and there is support you can get from your federal delegate, from your federal legislators. But I would not put that much energy into it. I would really focus on your state and your local. If I might be biased. So
I'll add to that. And I know people with the different leadership in their states have variability in how they need to move and what kind of hope they have. I think when it comes to federal legislation, just tangible legislation that you guys could be in support of, I'm aware of AABC's legislation that they're, advocating for several bills. And one is called the Babies Act, introduced in 2024, and it establishes a multi-state Medicaid demonstration program to explore more payment models for birth centers that aim to improve access and outcomes for low-risk pregnancies. And it also provides federal grants to help birth centers with startup or expansion costs, including construction, equipment, accreditation, and licensure. I'm like, okay, this is far out and maybe difficult to get, but nonetheless, I've like met with I'd started to build a relationship, thinking maybe years down the line when this is real legislation, sort of thing. But then there's the Midwives for Moms Act, which addresses the national shortage of maternal care, and provides midwifery education and programs and training opportunities. And then there's Midwives for Service Members Act, and it authorizes a pilot program to expand TRICARE. And I think there were some issues we learned that the birth centers who were involved in that, a lot of disappointments when it comes to federal funded related programs. But nonetheless, I do agree that state regulations are where at least New York can have more hope in. I think when it came to the Momnibus, it was like, how do we create the state version of that? Which, I think between what Massachusetts was doing, and also I want to lift up the state-based strategies for midwives and birth centers. Yeah, there we go. That a lot of the birth centers here and throughout, and members of Birth Center Equity contributed their knowledge and resources of a range of effective legislation for their state, and kind of has a compilation of productive legislation that we can learn from and drive from the community level. And I think a lot of that was built from what we're learning from the states, and the different, and being able to be thoughtful about how to personalize or make it meaningful for our particular state.
Thank you so much, everyone. And I just would like to offer too that when it comes down to doing the policy work, like the federal is going to be the hugest challenge right now, obviously based on the national landscape. But when you look at things like the Momnibus Act, one of the things like Mila already said, like trying to recreate that within your state and doing it based on the nuances of your state. Like some things that are in the Momnibus federal bill, your state may actually have or variation thereof. But if you look at that as kind of like the markers or the guiding points of what you want to see for equity, I think it's a good place of reference, but you definitely have to build out from the state right now. We don't have the strength, not us individually, but those in the federal seats, they don't have the will to match our needs right now, and match the things that we're trying to fight for. But I would always still encourage to people to kind of look to the Momnibus as a point of reference for how can you mirror that in your state and to what extent. I believe we have another question. These going kind of fast here. Let's see here. Goodness gracious, I do apologize for the two ums. I feel like maybe we might have already hit it already. Yeah, we did. Okay, thank you. I was like, this is moving fast. And there's the fourth one. So,
Well,
oh, sorry, Mila, go ahead.
no, you're good. I was just going to give you some time to filter out the next question by saying exactly what you just said is really summarizes what I wanted to share about, like how to appropriately make a different version of what Momnibus offers, and shift it towards what our states individually need.
Absolutely. Thank you, Mila. I don't see any other questions in the chat, and I know I'm watching the time. And so I would probably think it'd be a good time to kind of go to each of you and have everybody close out with something that you'd want everybody to walk away from this conversation. How do we get to our beloved 50 by 50 based on your journeys and your vision for this work? So I will start with Janine.
I'm sorry, I was chatting. Can you say it again, Crystal?
Sorry, no problem, no problem. I was saying we're gonna everybody will get a chance to close out and kind of share, how do you feel we'll get to our beloved 50 by 50 based on, your journey, where you've been and what your vision is, to see us all get there, to see us get to that all free that you spoke of at the beginning of the session.
Thank you. Thank you for repeating that. I was asking my own question, and got distracted. Yeah, I really think, in thinking about the 50 by 50, one thing that internally that we've been having a lot of discussion about is, the community knows about us, but I cannot tell you, I've been in spaces with, you know, clients, or what some people call patients, community members, legislators, doctors, and having conversations. I really think there still has to be a big push for people to understand what midwives do, our scope, our safety, what a birth center is. I like just met someone last weekend. I was like, they're like, what you doing? I'm like, a midwife. They're like, what's that? And I tell them, oh, they're like, oh, you mean a doula? I'm like, I literally said what I do. No, like I literally told you what I did. So that we've been working on, like, how do we, just let people know, like, we are an option for birth. We are a safe option for birth. We work in all kinds of settings. We provide these services. And I think that would help get to the 50 by 50, because if you don't know your options, it's like you walk into a restaurant and you don't know what's on the other side of the menu, you're just going to keep ordering that front side of the menu. So I really think it's important that we are sharing with people, our work and our desire for everyone.
Thank you, Janine. Shanae, will you like to go next?
Yes. What was the question?
To get to our beloved birth 50 by 50, what do you see as the need to get us there based on your journey thus far, and your vision for the future?
Yes, I'm gonna go back to the community. Like, it has to start at the community level, right? It has to be something that the community wants, the community is really willing to support, willing to come out for, something that they really need. So I think it starts there always. So I think in that comes with, how do you build up trainings, awareness, education, right? How do you, like, not even just train someone, but like empower them, like teaching them how to write policy, teaching them how to reach out to legislators, like teaching them to do the actual work, not just awareness. That's nice. But how do you actually empower and activate people, right? I think that's key and important as we move forward. I also think, I then think of all of the institutions. How are we building relationships with hospitals? How are we building relationships with the governor and our elected officials and the public health and the Department of, like, how are we building relationships and how are we interacting with them? I'm not a fan of most, right? But I also understand I need an eye on y'all. I need an eye on this hospital. So I need to serve on this board and commission. So I know what y'all doing. Right? So how are you integrating yourself into that system, right? And then, whatever changes you can make, which we know that those systems were designed to be that way, and we really need to start over, but we're going to reform for today. So how are we reforming and how are we, contributing to that? And then I also think of, like, how are we creating our own? So that's coalition building amongst our own community, amongst the people who are doing this maternal care work. Like, how are we building coalitions with each other? How are we tightening our relationship and strengthening it? How are we diversifying so we're not dependent on outsiders for funding the work that we want to do? So I think of it in those three buckets. How am I moving in those ways? I know for Delaware, like I was talking to like DSU, which is our HBCU, University of Delaware, which is another large university here, and like Del Tech. Those three colleges and university, like what would it look like for Delaware to have midwife a training program for midwives? Like what would that look like? How do we start those conversations? Talking to the schools. I've been talking to high schools who do like VOTEC trade schools. Like how do we have a birth worker pathway program? Like don't be scared. Call. You do not have to know everything. I promise you I don't. Sometimes I'm just like, hey, I'm trying to do this. I don't know how to do it. You do not need to know how to do it, because a lot of times I think that holds people back from taking action. Just do it. Put yourself out there, start meeting people, start having those conversations. And I think that's going to help us move forward to this 50 by 50.
All right, thank you. And Shanae, I just want to plug that I am a proud graduate of Delaware State University. And so yes, that's right, DSU, I thought you knew. And also plug that Delaware State University has a phenomenal nursing program. And so I know there has to be room there for some work and birth work at Delaware State. So I'd love to connect with you about that another time.
Yes, let's do that.
Mila, close us
Yes.
out, round it out for us.
Okay. I just wanted to echo what Janine said about education. And just today, someone referred to me as a midwife, and I was like, I'm a doula. I know I wear a bunch of hats, but midwife is not one. And we need to really know about these midwives so that we can be behind and support them. Because, all right, I could go on, but I want to acknowledge that. And then the conversation about integration. I think it's really important for us to look at our states, truly look and analyze and talk to each other and determine what is helpful so that we are not making up what we think is helpful based on the sector or the community that we're most immediately dealing with. And for example, oh, by the way, I wanted to acknowledge that I earlier said 2/3 of the counties instead of 1/3, but 20 counties in New York State lack, and that is maternity care deserts in a lot of areas. And so, for example, a strategy moving forward for us might be, as long as we, align on this, is incentivizing midwives to be in these counties. Whatever we can do to support their housing, stipend, something to put them in these places that they are most needed. And just again, that's one of the things that you might continue to determine as long as you're having the conversations with the people who are most impacted. And then coalition, that's been echoed many a time. And I just want to honor the collective wisdom and energy in the space, because while we're all working to advance birth equity and building community, we know it's challenging, and we need to remember we're not alone. We have the opportunity to really just tune in. And even if it's not actually sending that text or having a meeting, that we can actually remember that there are a lot of people fighting along this same mission, and every story, every lesson and connection we make is a strength to our movement. And so I hope that we'll continue to lean on each other, share resources, celebrate the wins. And this vision of 50 by 50, that means half of births in the US are going to be supported by midwives, and that is so doable. And to keep that commitment, it is ambitious, but together and with the creativity that we have, it is within reach. So I am encouraging us all to keep the building, keep learning, and showing up for communities, showing up for each other. And thank you, everyone who's displaying any sense of courage and willingness to do the work in your community and our community.
Thank you so much, everyone. I just wanted to lift up a couple of quick points as we're getting ready to close out. We know that birthing justice is not for the faint at heart. And it takes the will and the mindset to be in this space for the long haul. And as we go about this work, I want to make sure we also keep in mind that, one thing that we didn't really talk about too much today, but I definitely want to emphasize is that not only do we already have the tools to move us forward, but we want to make sure that we don't dismiss those tools as we look to be more progressive. And so I also want to lift up, curriculums, you know, and the teachers of our grand midwives who have gone on, right? And those who are still with us, we still need to uplift them in this birthing space. They cannot be left behind as we look to move towards our beloved birth 50 before 50, 50 by 50. And I also want to make sure that we always recognize that even in progress that should never compromise the culture and those who need it the most, right? And so sometimes when we get into these spaces, sometimes with legislators and different areas, as we're trying to move this work, we're often confronted with what seems to be progressive, but it can hurt what's indigenous to us, right? And so we want to make sure that our ancestral roots are not left out of the movement as we proceed forward to make it to our beloved birth 50 by 50. I want to thank everyone on the call today for joining us and thank all our panelists. I mean, if you were worried about the trajectory, you should feel a lot better with all these sheroes on the call who are leading it and letting us know that the future is still bright. The work is hard, but the future is still bright, and we have tremendous leaders out here. And let's all stick together. We are our own ecosystem. We have everything it needs to get us to where we're trying to go. And with that, I'll turn it back over to you, Nashara. Thank you for allowing me to close out this conversation.
Crystal, I'm not sure that I can close any better than that. That was wonderful. Thanks for your moderation and for that closing. It's Birth Center Week, y'all. Let's keep celebrating. Let's keep hanging out. There's another panel coming up on Friday, Lessons from the South. I'm going to ask Koyan to drop hashtags or a link from our IG in the chat so you can engage. And if I can share, Koyan, I'm going to share. Yes. All right. Join me and let's dance it out. You here? Can you hear me? Maybe we can turn off the spotlight and just see everybody as we all exit. Hey, there y'all are. We're so little, but it's so good to see you all.